I so we're looking at homelessness in Utah, and your annotated bibliography looks pretty good. I like how you talk about like what's going on in Utah and solutions that have been tried, and maybe some failures. And so I think what we could do when we're looking at scholarly articles is oftentimes research will look at what other cities have done, or even what other countries have done, and then they'll use that as kind of like a way to compare their interventions or preventions or solutions in a Utah context, and then try different things. So that's kind of the angle that I'll take from starting with this, but I think we could go in a number of different directions. So for the library, libutah.edu, there is this main catalog, and if you type in, oh, look at that, homeless, I've already done it, homeless and property values. I don't know what this is doing. Is this looking up these two sets of words, because this doesn't look at your cookies or history or anything like that. So it's not a smart search. It only looks for what you're typing in. So let me show you how to structure in the advanced catalog search if we're looking for a comparison of the effectiveness of solutions or interventions or preventions in other places. And we can use that to contrast with what's already been done. Scholarship also is very interested in looking at things from an objective, unbiased point of view. So they'll do instruments of measuring. So that might be like an interview, or it might be looking at demographics, or it might be looking at case studies, things like that. Focus groups, that's an instrument. But what we can do is we can put those different ideas on different search lines, and we can put in synonyms. So for example, our first one, homeless or homelessness, if we don't know what it's called, you just put an or in between and you put in a synonym. And since we know that this is exactly what we're looking for, we can say, I don't want to look anywhere, I want to look in the title of, so we're looking at millions of articles here. So we want it to be the most important thing. And then on this line, solution, so scholars typically don't talk about solutions, but they'll talk about a particular thing that they did. So solution sounds like it's been measured already, and that's the end of that. I think it's okay to include that as a keyword, but in social sciences, they also call it an intervention. So for example, one intervention might be universal basic income, or it might be tiny houses, or it might be, I don't know. Let's find out. Another one might be prevention. There's also looking at populations who are susceptible to homelessness. So that might be people who are growing up in families with domestic violence, or any number of different, what those are called risk factors. But let's start with these. And again, let's do title, since this has been written about a lot. And it's been written about, I've been reading a history book, and homelessness has been an issue for a long time. Okay, when you search the library catalog, it looks for books, book chapters, all sorts of different things. I'm going to move my head. And it'll give us everything. So there's 2,992. So we can narrow down to the scholarly things. Down on the right-hand side, there's facets that we can go through. And they are loading super slow. They're not loading at all. There we go. Okay, so out of these, we want peer-reviewed. Peer-reviewed articles, that means that if I'm a social work scholar and I have an intervention and I want to talk about how I measured it, asked questions, and I looked at the data, and then I combed through the data using a methodology or a method, then when I came to my conclusions or my research findings or suggestions, the evidence may suggest this, then I pass that on to other people who are social work scholars. Those are my peers, and they review it and see if it's worthwhile posting up in an academic journal, peer review. So that adds a little bit more validation and rigor to the process. Then we have a non-randomized feasibility study. So that's a methodology. That might be part of an instrument as well. Homeless veterans, there might be a particular population that they look at. There's prevention, but that's not preventing homelessness, it's preventing suicide. So you'd have to go through these. If there's any that you want to talk about in particular, so people focus on drugs a lot because addiction right now is it's a big risk factor for people who are on the edge of homelessness. If somebody's addicted to drugs, they're more likely to become homeless, for example. So you could do that. There's how people who are homeless, how they're perceived. So for example, there was a local library during the pandemic, the Mill Creek Library on 33rd. I think it was the Calvin Smith branch, but it closed, and there was a proposal to make that homeless shelter. And people were like, oh, not in my neighborhood. So not in my neighborhood, NIMBY, or NIMBY stands for not in my backyard. That might be another thing. So as you go through your annotated bibliography, is there something you want to narrow it down to? You can add those keywords. So for example, let's go back up to the top. So you can obviously go through these articles, but let's add a new line. I'll do NIMBY. Most of the time it uses regular words, but NIMBY is kind of like a popular acronym these days. So people want shelters, but they don't want it in their neighborhood. So that might be how you find that. What do we do? We'll go back to our original search. Oh, I could just go back, couldn't I? I hope I don't break it. The catalog looks at all sorts of different databases and things like that. So sometimes it chokes when you add other keywords. Are you choking? Poor catalog. There we go. I wanted to get back to the one that had peer-reviewed articles. Oh, I have to pick that again. Sorry. My head's just in the way. I'm waiting for peer-reviewed articles to come back here. You can look in Utah, but there might not be a lot. How would you add Utah? You would just put that in the keyword, in one of those keyword search lines. Okay, how do we find a keyword, or how do we find a scholarly article, and what do we do when we find one that we like? Preventing suicide. A targeted homelessness prevention with patients with drug and alcohol. So let's say this one is interesting. Or predictors of homeless. Ooh, I like that one. Oh, a rapid rehousing program. There's an intervention. Okay, say for example, something looks good. You just click on it, and there's many different databases in this. So we might get full text, or we might get links where it says full text available. That's not a deal breaker, but sometimes it breaks the catalog. So if you ever can't get full text, let me know, and just send me the title and as much info as you can. But on this one, it says look in these databases. Sometimes the list is long, sometimes it's short. And here you can view the PDF. Can I? Is it going to let me? So a scholarly article, like I said, is very, very formal, so as to not have any bias in there. So you'll always see the authors. It's black and white. There's no pictures of anybody smiling. It has an abstract which you can go in and you can glean information from. How the structure works is it starts out with the abstract and a descriptive title. Can I zoom in? They will go straight to the point, and they will say, Okay, yeah, so they're assessing factors in exits to stable housing, length of time that they're in a particular social service. Whoa, they analyzed 570,000 veterans who received services through this program. And oh, look at that. So participants' level of income, health status, use of other VA homeless programs, and whether or not they're in a city, so rurality, are consistent predictors of outcomes. That's a big deal. So if you know that people in rural areas who are veterans are more likely to need veteran services, you can provide those more um, what am I talking about? Like in a small town or something like that. So these are evidence that you can use to determine something that you want to talk about in your paper, if that makes sense. When you're looking at the paper, though, you've got the abstract, and then maybe the first page will be discussion, and then the rest of it will be about how they gather data and things like that. So if you get into like the third or fourth page and you don't find something you're interested in, move on to a different article. This one looks pretty good, but it's very specific, isn't it? So it's only a minor contribution. By the way, when you go back to this library thing, the catalog, there's a citation generator right here. So if you don't want to write out your citations for yourself, you can grab them here. There's MLA and there's APA. Okay? Okay, so when you get a hold of a couple of articles, they are going to be contributing evidence to what you've already found. So don't look for something that says everything about your topic. They're all going at it at a little slice at a time. And citation generators in the library catalog. If you're unstuck, email me. I'm here to help. Nice talking with you. Good luck. And I'm very pleased to see people working on this topic. I think it's very valid. Have a good one.